led her to this talk today. Eva, thank you for joining us.
Hi, everybody. I'm Eva Fletcher. I have a few professional roles. I have been a physical therapist for over 30 years and worked in inpatient, so mostly with neurological patients in in the hospital for most of those 30 years. So that means I worked with a lot of patients that had issues with balance and falls or recovering from falls. I have really focused on fall prevention and kind of coming back from that. As a PT in the hospital, I obviously did the physical therapy part, but I felt very strongly that my patients needed more advocacy than they were really getting in the hospital situation. And I had kind of the honor of having chunks of time with my patients, whereas other people were kind of in and out, and I had more time to build their trust. And so I used that to help advocate for them. So um, I also now work as a health advocate with a group called Gray Zone Health. And I help people navigate the complex diagnoses or lack of diagnoses that are so frequent. And if you don't really know how to navigate the healthcare system, you can get lost. So I use my two careers kind of together, but right now I'm focusing more on advocacy. Um, so that kind of leads to this talk. It
And
is
and
about,
you and you and I have something in common as well, because one of the reasons why I'm so interested and very passionate about this topic is that almost 3 years ago, my mom suffered a fall up to just 2 stairs, and it led to her death six days later. I mean, it was catastrophic. And I think you have a similar experience, different outcome with
mhm,
your mother, right?
yeah, yeah, yeah. So that is kind of where my two worlds came together a little bit. My mother's story is I was traveling in Europe in Barcelona, like I had been there for 12 hours, and got a call that my mom, who was then 80, had fallen or passed out and fell and hit her head on concrete floor and sustained multiple cranial fractures and subdural hematomas, which are brain bleeds. Um, Her fall was most likely due to something called orthostatic hypotension, which is a sudden drop in blood pressure, and that can just make you pass out and go down. Um, and this was probably due to maybe an underlying autoimmune disorder that has a name called POTS, that's an acronym, or possibly could have been medication related. We don't know exactly, and she has no memory of the event. But this is an example of kind of how an underlying condition or a side effect of a medication can cause falls. And I'll kind of go at the end, tell you a little bit more about her outcome because it was different, thankfully different. And
Mhm.
I'm so sorry, Robin.
Yeah.
It's terrible. And to watch that as a
Mhm.
child or a loved one is really, really difficult.
And it's very, very common. That's why we're having this
Mhm,
this
mhm.
talk today. It's so very common. There are so many ways to prevent falls. So, very excited to hear what you have to say, Eva.
And my mom was brought to the hospital where I worked. And so I was with her the whole ride. And I think if I wasn't there to question, to advocate, and at times even lead her care, I am convinced she probably would not be here today. And that's a little plug for the advocacy part, but I'm going to focus on the falls. Um, so I'm going to be discussing a topic that affects millions of older adults worldwide, falls in the elderly. Falls are one of the leading causes of injury, disability, and even death among older adults. This lecture will cover the major risk factors for falls, the impact of falls on elderly individuals, and strategies for preventing and managing falls. And while the focus is primarily on the elderly, anybody can fall. And, you know, some people are at higher risk for falls than others. And some things that can put you at a higher risk are versus age. So people over 65 is kind of the data that says there's higher risk of falling. Anybody that has mobility issues, so difficulty walking or standing up or impaired walking patterns, people with balance disorders or increased kind of postural sway, inability to recover from a quick movement, people that have impaired vision or difficulty with depth perception, glare tolerance, peripheral vision issues. That all feeds into it. Medications, taking certain medications, especially anything that affects the nervous system, psychotropics, blood pressure lowering medications, sleeping tablets, anticonvulsants. Those can all cause issues that can lead to falls. Foot problems that cause pain or wearing unsafe shoes. That's a pretty common one, wearing shoes that don't fit or flop around and don't give good support. People with cognitive impairment. So they say mild cognitive impairment, but any mild to moderate to severe impairment can, or certain types of dementia can lead to increased falls. Fear of falling, so worrying about falling, can
Hmm.
also add to that. And, I'll kind of go more into that, but if you are always worried about something and you're tense and, you're kind of just ready to fall, you're not going to be as relaxed and normal in your movement. So it puts you at a bigger risk for falls as well.
Interesting.
Home
What about
hazards,
what about alcohol use? Is that
definitely.
part of it? Yeah.
Yeah. And I think, I guess that would not be quite the same in category as medications, but anything that is going to affect your
Hmm.
cognition or your
Hmm.
balance or your kind of awareness is going to definitely
Hmm.
put you at higher risk. And then with alcohol in your blood, it's actually a blood thinner, so it can cause even more problems if you do fall. Um, Home hazards are also big. So safety hazards in the home or community environment, and I'll go more into that as well. So this kind of the scope of the problem, falls are a major public health issue. And according to the CDC, the Centers for Disease Control, 1 in 4 older adults experiences a fall each year. These falls often can lead to severe consequences, including fractures, head injuries, and ultimately loss of independence. And in fact, falls are the leading cause of injury-related deaths among people over the age of 65. Um,
The leading, or one of the leading? The leading.
it's the leading one. And then I think,
Okay, that's the big
um,
headline there,
mhm,
everybody. That's,
yeah.
yeah. Okay.
And it's, one that could many times, not all times, be prevented.
Hmm.
Over 800,000 older adults are hospitalized each year due to a fall injury. And approximately 30 to 40% of older adults who fall will suffer moderate to severe injuries, including fractures, bruises, or head trauma. Head trauma is a big one because, you don't have maybe as quick of a reflex, get those hands out and your head hits.
Yeah.
And 10 to 15% of older adults who experience a fall will develop a long-term disability that affects their mobility and quality of life. That's, what you want to avoid for sure. Understanding kind of the scope of the problem really underscores the importance of preventing falls and improving care for those who are at risk for falls. So some risk factors, anybody can fall, but falls don't just happen randomly. So it's a combination of intrinsic or internal factors and extrinsic or external factors that put you more at a risk for falling. So we'll kind of break those down. The intrinsic risk factors or kind of individual factors that increase a person's likelihood of falling are, and this is not complete, probably there's all kinds of things that can cause, but I'm going to kind of go through the main ones that
The biggies.
cover a lot
Yeah.
of it. Yeah. So age-related changes in physical health. As we age, muscle strength, bone density, and balance typically decline. And this makes it harder to recover from a loss of balance and also increases the likelihood of falling. Vision impairment is another factor that is something that glasses for reading is the start of it, but age-related conditions like cataracts, glaucoma, macular degeneration, anything that reduces visual acuity can make it more difficult to navigate the environment. Another one is hearing loss. So,
Hmm.
we use hearing
Interesting.
we use it to warn us of possible dangers that could cause a fall. And we use it more than we think. Like we're getting feedback all the time. And so like even if one side isn't hearing right, you're just hearing it from one ear, it can just throw off your kind of perception of what's happening in the world. Chronic health conditions, and this is for sure not complete, but the neurological disorders such as like Parkinson's disease, stroke, or dementia that impairs motor control and coordination, all that lead to increased risk of falls. Osteoporosis and arthritis can weaken bones and joints and make fractures more likely if a fall does occur. And then cardiovascular issues are also big. Things such as low blood pressure or arrhythmias can cause dizziness or fainting spells, which is exactly what happened with my mom, we think. We know, but that can make you lose consciousness and go down and have a whole plethora of issues to follow. Medications, some medications, particularly sedatives, blood pressure medications, anything that affects the nervous system, they can all cause dizziness, drowsiness, or a decrease in cognitive function, which then can interfere with balance and increase fall risk.
Is there any evidence that usage of like sleeping medications is increased as one ages? I hadn't even thought about that.
I don't have probably the research right now to back me up, but from talking to patients that are
Hmm.
elderly, a lot of them do take and some kind of
Yeah.
assistance to help them sleep. I know that physicians that really are in tune to the elderly try to steer them away from that because
Hmm.
of the risks that go with that.
Yeah.
But there's also a lot of doctors that just throw medications, and it medications also are not broken down the same in us as we age. So it might last longer in somebody's body that's not breaking it down, and then you add
Oh, that's
more on top of that,
interesting. Huh.
and that can be a whole other thing in itself. And then polypharmacy, or the use of multiple medications, also increases side effects that contribute to falls. And this is also where maybe somebody's getting medications from multiple different providers, and they don't all look at the list as they're handing it out, or they miss it. I've had patients where that happened. Actually, my mother-in-law, um, she was being given a diuretic, and she went
Mhm.
to the emergency room because she had an emergency, and they saw that she still had swelling, and they didn't look. I was not with her, so I was not advocating for her at the time, but um, they didn't look at her whole list from the care facility, and they gave her another really strong diuretic on top of that. And, her blood pressure plummeted. She was so over diuresed, she was very dehydrated. And so, that right there makes you weak, makes you high risk for falls. Um, Improper dosing, taking too much or too little or at the wrong times also can affect your risk for falls. So those are kind of intrinsic. Extrinsic risk factors are more kind of environmental factors that increase the risk of falls, and these are often modifiable and can be managed with the right interventions. I did a lot of kind of evaluating people's homes and looking for making sure that it was safe, and going over their mobility in their homes. And that's really helpful sometimes to just watch someone in their own environment and how they manage. But some factors are, there's home hazards. So poor lighting, loose rugs, cluttered walkways, uneven flooring, all of those are trip hazards. Not having grab bars in the bathrooms or railings by the stairs, um, bars and tubs and showers, all of that can make it difficult for people to maintain their balance. And if they do lose their balance, they don't have anything to reach for and they go down. And a bathroom is a really not a great place to fall. There's a lot of places to hit your head and to get stuck, but there are a lot of falls that happen in the bathroom.
Eva, I
Um,
thought it was interesting when my sister she was actually in a dementia care unit, and they forbade people from having pets because they'd had so many issues with pets where the leash gets in the way or,
yeah,
yeah. So I just thought it was really interesting.
yeah,
It's a
I
good
didn't
idea.
put that. Yeah, I didn't put that in here. But pets for sure on many levels, leashes, little dogs or cats are easy to trip over. Big dogs can knock you over with their tail or when they get excited. Um, but that's a really tricky one to modify because, we love our pets, and sometimes that is almost as important as or more as limiting the fall risks. And so you just have to kind of work to figure out the best way of managing it with pets. But yeah, that definitely adds to the risk. Um, so some consequences of falls. Falls can be devastating, not only physically, but psychologically and socially. Um, the most common injuries from falls in the elderly are hip fractures, which can lead to long-term disability, the need for surgery, extended rehab, complications that can come from being stuck in bed, blood clots or pneumonia. There's it used to be almost a death sentence for people in the past.
Mhm.
Now we get them, I used to get them up when I was in the hospital, we get them up right after, right after surgery, next day or even that day. And they do that with hip replacements, knee replacements. Everybody's up and moving soon, and that's to get them so they don't lose strength and they, don't have some of the other issues that can affect you when you're not mobile. Um, I have she's kind of a great aunt, I guess. Um, she's 91. She was 91. Now she's 93. And she was very active person. She was at the casino. She loves to go to the casino and do a little gambling. She puts a $20 limit on it, but she's having a great time. And she just turned too quickly and she fell and she fractured her hip. And after a failed surgery, they put a rod in and it loosened up and she ended up having to have a total hip replacement a few weeks after the original surgery. So that was a lot of time down. She had a long rehabilitation and she was able to return to her apartment and she can walk and she's very sharp, so she knew kind of what she needed to do. But, she has a really significant fear of falling now, and she uses a walker whenever she goes out, more because of that fear. And she doesn't go out as much as she used to because of that. Um, so it can change a person's
It
life.
can build upon
Yep.
itself. And Patsy, thank you for sharing. She said that since her shattered femur, her once broken leg is shorter than the other by half an inch, which is a lot, which means she needs lifts on the bottom of the shoe, and it's too much for the inside of the shoe. Difficult and expensive to find people to do that, and Medicare and insurance doesn't pay for it. So, um, yeah, uh, fall consequences can be, you know, super
Yeah.
challenging. So,
Life
And you don't even
changing.
have to be old. My
Nope.
I put in the chat my friend who just she shattered her femur a year ago and same problem that her every all her shoes have to have lifts in them and it's very expensive. It's crazy.
mhm.
Hmm. Hmm. Yeah. Um, Head injuries, including concussions or intracranial hemorrhages, can be particularly dangerous, and even more so if somebody is on blood thinners or if they are drinkers, alcohol also blood thinner. Um, I used to see a lot of patients like this that came in, older patients mostly, but also younger people that maybe were on blood thinners for one reason or another, or not even on anything. They just fell and they hit their head. And, um, you know, it was the ICU, the neuro ICU was full of people that this happened.
Mhm.
And, sometimes it's not immediately apparent either. So they can hit their head and not even really know it and have kind of a slow bleed.
Mhm.
And symptoms don't even show up for a week or even more. And then all of a sudden they just start acting kind of funny and people are like, nothing happened. I don't know why. But then when they look back, they can pin it to this fall that happened, weeks ago. Um,
And
this,
sometimes people are not very honest. Like I remember that towards the end of her life, my mom had some falls and didn't necessarily tell me. And then we'd do a FaceTime or whatever, and I'd say, "Hey, what's that? It looks like you have a bruise on your face." And she, "Oh yeah, it was just a little fall." So I
yeah,
don't know if there are some strategies for helping people um, make make sure, especially people who are living alone, making sure that somebody knows about that or,
Yeah, people like to downplay there, and there's this whole kind of being embarrassed about falling
yeah.
and not wanting the help. I had a fall. I was walking across the street from the hospital and my foot just slipped right out from under me and I fell and I broke my ankle and I
Mm.
was laying there on the ground and someone across the street was like, "Oh, are you okay? Can I help you?" I'm like, "No, I'm fine. I'm fine. I can do it." So ridiculous, it's just kind of this
Yeah.
innate thing that people do. They want to You want to stay independent and you don't want to look kind of weak um, and then if you add on top of that, maybe fearing that if you are having falls, people are going to make you move from somewhere that you don't want to move from.
Yeah. Yeah.
It really can cause havoc, and for the family, you just want them to be safe, but they don't want to leave from where they are. Um, so that kind of leads to the psychological impact of falling. And the first thing, as I've already kind of talked about, is the fear of falling. That's one of
Hmm.
the most common psychological consequences. And that in itself can lead to a downward spiral where the individual becomes less active, the muscle strength declines further, and the risk of falling increases even more. Um,
Are there some specific strategies to deal with the psychological component of fear of falling?
yeah, so knowing that preventative measures are in place can reduce anxiety about falling.
Hmm.
Engaging in activities that promote balance and strength can also, it boosts your capability, but also your mental well-being.
Hmm. Hmm.
Um, I think giving people the knowledge, the education of what they can do to prevent falls and real concrete tasks to work on, not just
Yep.
say, "Oh, just pull up the rugs and work on balance." Like they need a program. And I do have some resources later that it looked pretty good and have some tools that actually
Yeah.
walk people through it.
Yeah.
But
That's
I will
great.
also go over some kind of preventative things here as well.
Perfect.
Um, the fear of falling is one thing, and then depression and anxiety feed in with that fear. And then if you've had a fall and it leads to a loss of your independence, or if
Hmm.
recovery is really slow, that adds even more depression and anxiety, which can add to more fear, which can then just kind of stop you where you are and you need to move. You need to, sometimes it actually takes talking to somebody that really specializes in working with, I mean, this is primarily about elderly, but um, working with therapists, but physical and psychological therapists, I think. And
Hmm.
it has to be kind of a team.
Yeah.
Um, when I worked on the rehab floor at my hospital, that's what I used to do. We actually had a psychologist on our team, and it was so great because she would address all the issues and give us feedback, and we would give her feedback, and it was just so helpful to have that, and for the patients as well.
For
That's
sure.
not very common anymore.
Yeah,
Yeah.
yeah. Maggie Pheasant had earlier asked, and I think this plays into this section about pets and best practices for pets because pets are, helpful in terms of providing mental well-being, source of comfort and friendship, but they can also be challenging. So I don't know if you have any
Yeah.
suggestions.
Um, I can kind of tell you what I used to tell my patients, and
Mhm.
that would be, um, being aware of the risk for sure, and trying to work with them to, if they could, have somebody that would come and walk the dog or um, do the parts that were difficult for them and that put them at more risk. But sometimes there's just no good method to deal, and you have to just get as many of the risk factors removed as you can. But
Mhm.
but the dog or the pet is so important to them, and sometimes if you take that away, they kind of lose the will to even go on. That's their
Right.
being, not their
Mhm.
person, but their,
Yeah.
I mean, their kind of reason for keeping going on. So it's definitely a discussion and something that you need to work on together. But I don't have the perfect answer
Yeah.
to it because I don't think there is a perfect answer, but it's making people really just aware and working on balance skills. I would have them actually physically show me what they do and then see if there's things that we can do to make it better, safer. So
Yeah.
I don't know if that answered it, but
Yeah. I think so.
um so with the physical, psychological impacts of falling, then there's the social consequences too, which is loss of independence due to falls, and that can lead to isolation, social isolation. The fear of falling, like with my great aunt, can cause people to limit their activities, reducing opportunities for social interaction and exercise, which in turn then increases the risk of falls. So I saw one question about prevention and management of falls, and so this next section is on just that. Um, while falls are a serious risk for older adults and people at fall risk, there's a number of strategies that can help prevent them and reduce their impact. So it's not all doom and gloom. Um, Balance is vital in preventing falls, and researchers have found that balance begins to decline in midlife, starting around age 50. I already am feeling like my balance is not what it used to be, and it's really important to practice balance skills ongoing to avoid falls. The main systems that we use for our balance are the visual system, our eyes, vestibular or inner ear, and our proprioceptive system, which is sensory information from muscles and joints. All of these send information to the brain to maintain equilibrium or balance. So the visual system uses information from the eyes to perceive the environment and adjust body position accordingly. The vestibular or inner ear system provides a sense of balance and information about body position that allows us to compensate or correct when
Mhm.
there's external or internal factors that make you lose your balance. And then the proprioceptive system is the sense of body position and movement. And it's a complex process that involves many parts of the body and nervous system. And this is how the brain knows what our arms, legs, and other body parts are doing and where they are in space. And if you're not feeling where your body parts are in space, I had stroke patients that completely
Mm.
lost all sense of all proprioception. They didn't know. If they didn't look, they didn't know where their leg was. And then you try walking and you think your leg's going with you. And so big
Is
fall
isn't
risk.
that the reason why I can't remember the name of the Olympic gymnast said that she took a break from her career. She was at the top of her career, and I think it was due to that part of her system not working, not being
Hmm.
able to perceive herself in space. Very dangerous when you're a gymnast.
Yeah.
as well
Yeah.
as a
Oh my
person.
gosh. Yeah. You fall doing those things. That's
Yes,
not going to
yes.
be a good thing. Yeah. I don't know for sure about that, but
Mhm.
yeah. And anything can affect that system. So stress or overworking your body or brain can all affect that too, as well as neurological processes. Um, so some key points are that the brain integrates information from all three of these systems to maintain balance, and any disruption in any part of that trio can affect your balance. Um, so fall prevention. Number one, and most kind of important and easily addressed, is exercise and physical therapy. So it's not going to completely make you fall proof, but regular exercise, especially exercises that improve balance and strength, such as Tai Chi, yoga, Pilates, or targeted physical therapy to actually work on strength and balance, can help reduce the risk of falls. And strengthening muscles, improving flexibility and coordination can provide the stability needed to prevent falls. Something simple that I pretty much had every patient do if they could. I tell all my friends' parents, and I do it myself actually. But I like to have my patients do these three basic things every day.
I'm
And
writing them down. I'm writing
okay.
them down. Can't wait.
So I have people do like 5 to 10 just sit to stands from a chair. Um, just going up and down, not using your hands, or if you can't do it without hands, you'd use your hands, but that's going to increase your leg strength, your quads, and also kind of just prepare you for those transition movements. But so that's an easy one. We do it all the time anyway, but doing it in repetition can really make a difference. And I mean, I've done it before. I've done quite a number of them, but I'll even feel it in my legs, and I'm pretty mobile. So, um, and then practice for balance. Practice standing on one leg. Stand next to a counter and hold at least 10 seconds on each leg if you're able. Even if you're not able to completely stand just on one leg, I would have people just kind of shift their weight so it would be mostly on one leg, or a caregiver can be, I would be right there with my patients and have my hands right ready to catch. But you have to practice balance, because if you don't use it, you definitely do lose it. And then just moving every day, whether it's a program or not, walking, some kind of exercise, even doing exercise from a chair. They have some great actually chair yoga and Pilates programs that you can get a pretty good workout. And so those three things, just move, practice your balance, doing the sit to stands, super important. There's a lot more you can do on top of that. And um, I would recommend going, if you have balance or strength issues, going to see a PT and making sure that when you make the appointment, ask them, do they have some expertise in balance? And because, there's all different kinds of PT. There's people that look more at sports injuries, and there's people that look at balance. And that makes a difference. You want someone that's going to really take it seriously.
It seems like there are more little boutique balance like studios that I've noticed in the last, several years. And that would make sense, aging population, that kind of thing. But how is that common, or is that just in pockets of the country?
I haven't seen like specific kind of studios here in Seattle. I know of a very good like balance PT clinic here. Um, But I do think that if you go to yoga and Pilates classes, that there is more focus on balance in
Mhm.
that for
Mhm.
everybody, because it's, you have to be stable in order to move. You have to have a stable position to move on. Um, so other fall prevention things, home modifications. And like I said, I used to go into people's homes and I would have a whole checklist and give them my recommendations. And that's as much as I could do for the most part in other people's homes, but in your own homes or loved ones that you have a little more influence on, removing hazards such as rugs or clutter, installing grab bars in bathrooms and handrails on stairs, lighting, improved lighting in hallways and staircases. That's huge. And then considering maybe non-slip mats in the kitchen and bathroom. Those are kind of some simple modifications. Then having regular vision and hearing checks to detect any vision or hearing problems, getting corrective lenses, cataract surgery can make a huge difference and reduce fall risks. And hearing aids can make a difference as well, because you can detect where signal hazards are. Medication management. Everybody should regularly review their medications with their healthcare provider to identify any drugs that might increase fall risk or reduce polypharmacy, too much medication. And there's specialists now that will do that. That's what
Mhm.
they do. And
How
pharmacologists.
do you find them? Through the hospital or through a pharmacy
Yeah,
or?
I found some through hospital
Mhm.
systems, and I just
Mhm.
looked up pharmacology, and not everybody has them, but it's a great service to offer, and they just go through everything and try to decrease it down to the very
Mhm.
minimal.
I
Um,
wonder, I wonder if university pharmacy programs would have that as a
they
just a resource.
they
I don't know.
Yeah, I
might,
think they do. And
yeah,
also
yeah,
pharmacists could refer you if you really needed a
yeah,
pharmacologist.
yeah.
So yeah,
Especially a pharmacist, maybe in a bigger
a
system,
big
because I think
system.
that
Yeah.
the kind of community ones are so overwhelmed and maybe not as connected. But so that's medication. Footwear, encourage the use of well-fitting shoes with non-slip soles. Avoid backless slippers or shoes because they can come right off and trip people. Um, Assistive devices. So walkers, canes, people might not want to use assistive devices due to a combination of factors: social stigma, fear of appearing disabled, concerns about aesthetics, lack of awareness about available options, um, maybe difficulty learning to use the device, so they just don't use it, concerns about cost, and a perception that using assistive devices um, will make them more dependent and
Mm.
also signify a loss of independence or ability. Um, if someone's prescribed an assistive device for balance or safety, it's not going to help unless it's actually used. And I've run into this so many times. People, you don't want to use things that are going to make you look weaker or older or slow you down. And I've had to kind of just resort to fear factor a little bit and just tell people, if you're not using this thing that's going to make you safe, you could end up falling and then maybe not be able to walk at all, or you're going to have to go move to somewhere where you get care all the time because you could end up disabled. And so you have to kind of balance what is better, using this device that's going to help you be more mobile or be immobile. And that's a hard one for some people, especially. And then just educating people, older adults, people at risk for falls, their caregivers, educate, educate, educate about fall risks and safety measures that can kind of empower them to take action to protect themselves. And sometimes if you can lecture at somebody, but if you give them something they can actually do to make a difference, it can give them a little bit more feeling like they're involved.
Agency. Yeah.
Mhm.
We had a question from Patsy, and I don't know if you have a point of view on the poles versus canes versus walkers, like the pros and cons of using those particular devices, or
Like a transfer pole.
no, like poles,
Oh,
like
walking poles.
yeah,
Okay.
walking
Yeah.
poles
Yeah.
versus a cane versus a walker.
Yeah. A walker is going to be the most secure, the most stable. So,
Because that has 4 points and is
yes.
broad.
Yeah.
Yeah.
And a cane, walking poles are okay. I think if you're pretty mobile, it's okay for just a little bit of extra balance. And same with canes, but a cane is much less likely to keep you from falling than a walker is. But
Mhm.
you want to have the least restrictive assistive device,
Mhm.
but the safest. And that's going to be definitely just an individual kind of, you get evaluated and see what you need as an individual. It's hard to kind of have a blanket comment
Gotcha.
on that, but
Yeah.
for sure I would, you want someone that knows what they're talking about, a PT come in and say, hey, this is going to be what's most safe, and maybe progress them to the next level when they're ready. Um, it's also important to teach people how to get up safely after a fall and how to call for help. So, right after a fall, it's essential to make sure that the person is not injured. If you're alone and you fall, just sit there for a while, make sure, kind of assess yourself. If you're with somebody that falls, you help assess. If they can't get up, or they have some kind of pain that they should not be putting weight on, or they feel dizzy, then you should seek help immediately. Call 911, and they can evaluate and determine the next step safely. And then a healthcare provider should assess the individual for any injuries and also the underlying cause for the fall if they can. So maybe blood pressure medications or whatever it is that needs to be investigated. Sorry, I think I'm going long.
Nope, nope, all good. We have
Okay.
10 minutes, so it's all
Okay.
good.
And then rehabilitation and physical therapy after a fall is really important to help restore mobility and strength. And a personalized rehab program can address any balance or coordination issues and help the individual regain their confidence, which is super important. And the sooner that is started, the better. So, the fear, if you can address it right on when it happens, maybe doesn't get as deeply rooted as it could. So not only does PT and exercise address the risk factors themselves, addressing them before these things are permanent, the loss of strength, the fear, all of that.
And I
gamut.
love that Ray Drazen says that mindfulness is the most important thing when walking. So
Yeah,
such a good
yeah,
reminder. Thank you, Ray.
yeah. Not walking, texting and
With your
walking, or
phone. Yeah.
yeah, definitely need to be aware. Everybody.
Yeah.
Um, okay, so benefits, I'm getting close to the end, but benefits of fall prevention, enhance quality of life. So fall prevention strategies, especially those that focus on exercise and balance, can enhance overall well-being by improving physical fitness, social engagement, and the ability to perform everyday tasks without the fear of falling. which then leads to a higher quality of life with more opportunities for active living, social interaction, and participation in hobbies or work. And this leads to better overall health outcomes and life satisfaction. Preventing falls can prevent long-term disability, hip fractures, head injuries. They can lead to permanent loss of function, and fall prevention can help avoid those severe outcomes. Fewer people experience chronic pain, require long-term care, or have permanent loss of mobility if we can prevent the falls from ever happening. And that allows people to keep their autonomy and quality of life over the long term. Implementing fall prevention strategies at a community level, like safe walking environments, social programs, public awareness campaigns, that can also foster a culture of safety and well-being. And increased community awareness of fall risks can encourage collective efforts to reduce hazards in public spaces, making it safer for everybody. Social programs that promote exercise and wellness can improve overall public health and essentially reduce, the cost on society of falls and their consequences. By preventing falls and fall-related injuries, it decreases the need for emergency services, hospitalizations, surgeries, long-term rehab. It basically kind of decreases the burden on caregivers and long-term care facilities, and that translates to lower medical costs, both for individuals and the whole system, healthcare system as a whole. And fewer hospital admissions overall. So, falls are a significant concern, but they're not inevitable. There's things we can do by understanding the risk factors, intrinsic and extrinsic, and taking proactive measures. We can reduce the likelihood of falls and minimize their impacts. Prevention strategies, exercise, home medication management, home modifications, regular health checkups, they can all make a world of difference in maintaining the safety and quality of life for those that are at risk for falls or even aren't, because they basically are somewhat all at risk. Remember that preventing falls is not just about reducing physical injury, but ensuring that people are able to maintain their independence, dignity, and overall well-being. Fall prevention strategies can significantly improve outcomes for those at risk of falls, and particularly among those that are older or have medical conditions. And as a PT and a health advocate, or as a caregiver, if you have someone that's a fall risk in your life, it's important to emphasize what can be done to decrease falls. Because there is a lot that we can do. And if we can remain active and strong and work on our balance, you can reduce those fall risks. So kind of back to my mom's story. She was in the hospital for a month, my hospital, and she had, low blood pressure emergencies, seizures, cognitive changes, times of pretty questionable care. But I'm happy to tell you that she had a pretty good outcome. She's mobile. She's got all her cognition back. She's intact, independent with an active life. She still drives. She goes to the gym and exercises. She does her balance exercises, and she's socializing, and she's 86 now. So
wow, amazing.
She had some, permanent losses from her head injury. She lost 90% of her hearing, just immediately, taste and smell, vestibular dysfunction, so ongoing balance problems and blood pressure issues still. Um, so all of those, every single one of those puts her at risk for falls. We've made changes to her living areas with railings and shower bars, seats. She did her balance PT, and I had somebody else do her PT. And she still does all her strengthening and balance exercises now at the gym. She uses the cane or walking poles when she feels unsteady, and she's attuned to her blood pressure symptoms and deals with them. We stay on top of her medications, and we've worked with a really good physician that eliminated meds that are not necessary, changed ones that were having more side effects. So, overall, hers is a story of success, and but also one that shows the importance of doing what you can to prevent further falls.
Mhm.
And, I feel very lucky. I'm so sorry, Robin, that things didn't turn out that way for you, but it's a devastating thing that can happen in an instant. And if there's things that we can do to decrease the risk of that happening, then it's all worth it.
Yeah, absolutely. And one of the things that I was curious about is if falls affect people of different race, backgrounds, ethnicities differently.
Right. Yeah. And
Yeah,
I had a little bit about that in here, but I didn't get to that.
yeah.
Um, I read up on that a little bit more, and
Mhm.
the data shows that people that are of color have a less likelihood or a lower instance of falls than white people do. And I
Mm.
looked in to see why that was, and it's all kind of there. There isn't enough research to say exactly, but a lot of it points to that um, some people have access to healthcare that others don't, that maybe allows them to live longer.
Mm.
And as you age even more, you're at a higher risk for falls. So maybe that is
Gotcha.
part of it. There's
Yeah.
also kind of what is being reported or not too.
Yeah.
Yeah. And that is a big player in that.
Yeah. Well, this talk was really chocked full of really interesting advice, and really appreciate everybody who also tuned in to provide their own personal experiences and also suggestions. This will be posted and available following the call today. You'll get an email with a recording of this session. And I can't thank you enough, Eva, for sharing your wisdom and years of experience and very specific practical advice as to what we can all do to help in the effort to decrease fall risk. So thank you so much.
Thanks, Eva.
You're welcome.
That was
You're
great.
welcome.
Mm.
And there are a few resources that have some good tips and more information if you want to look through those. I think Chloe was going to put those up. Yep, there they are.
Yep. Chloe just posted those, and those will also be posted in the classroom. So, so thank you so much. And next month, we will be talking about gaslighting in the healthcare system with Nicole Rochester. So put that on your calendar for the 10th. And I'm sure we'll see you at another upcoming event soon. Thank you so much.
Thank you.